Following an inversion sprain, the Talar Tilt Test is used to assess the integrity of the ligaments on the lateral aspect of the ankle, particularly the calcaneofibular ligament, referred to as the CFL, which stabilizes the talus and the calcaneus in the prevention of excessive inversion of the foot. As you can see here, the CFL, which is circled in green, originates at the inferior aspect of the fibula, slightly anterior to the midcoronal line, and inserts posterior to the calcaneal tubercle, crossing the tibiotalar and subtalar joints. The CFL is under maximal tension when the ankle is in a dorsiflex position. Injury to the CFL occurs when the foot is rapidly and forcefully inverted with the ankle in a dorsiflex position, or when the foot is rapidly and forcefully inverted with the ankle in a plantar flex position, after the anterior talofibular ligament, also known as the ATFL, has ruptured and the force continues posteriorly around the ankle. The Talar Tilt Test can also be performed in varying degrees of plantar flexion and dorsiflexion to examine the integrity of the ATFL, which is circled in red, and the posterior talofibular ligament, also referred to as the PTFL, circled in purple. When examining the CFL, the Talar Tilt Test is performed with the ankle in a neutral position by tilting the calcaneus and the talus as a whole into inversion as a single unit while stabilizing the distal tibia. It is important to grasp the calcaneus and the talus as a unit to minimize the subtalar motion that occurs between the two. When examining the AFL, the test is performed in more of a plantar flex position due to the origin on the anterior portion of the fibula and the insertion on the lateral portion of the talar neck. When testing the PTFL, the test is performed in more of a dorsiflex position due to its origination on the posterior portion of the malleolus, projecting posteriorly to insert on the posterior lateral portion of the talar body. Okay, Katie, I just finished testing your uninjured ankle, and now I'm going to move to this ankle, which you say that you've had a sprain earlier in the week, and you rolled outward, so I suspect there might be an injury to one of the three ligaments on the outside of your ankle. I'm just going to run through a test called a Talar Tilt Test to see if they are intact and if they're still supporting the outside of your ankle. Okay. So moving through the positions that your ankle is in enables me to test and see if it's stable in all the positions you might perform activity in. Okay. The results of the Talar Tilt Test are very difficult to interpret due to the wide range of normative values. One recent study found normal inversion to be between 0 and 27 degrees, whereas another found normal to be between 5 and 23 degrees. These two studies also gave a general rule of thumb for determining if the integrity of the lateral ligaments of the ankle were compromised. The first study says at least 10 degrees difference from the uninjured or normal side is needed before the lateral ligaments were determined to be compromised. This also is the criteria for a positive Talar Tilt Test within this study. In a second study, at least 15 degrees more inversion on the injured ankle was needed, considering the normal ankle is uninjured and uncompromised. This finding also correlated with rupture of both the ATFL and CFL. When findings from the Talar Tilt Test were compared with MRI findings, patients with a 0 to 4 degrees difference ranged from no ligament injury to a double ligament injury of the ATFL and CFL. A Talar Tilt Test between 5 and 15 degrees difference correlated with a triple ligament injury of the ATFL, CFL, and PTFL. And a Talar Tilt between 16 and 45 degrees difference required surgical repair of the ligament injury, with all having a complete rupture of the ATFL.